How can we understand this transplant program as such? Many of our listeners may not be medically trained as well. So for those people, how will you explain this transplant program as such, other than just the surgical part of it, how it is a total program?
So the focus is not on the surgery anymore, but it's on the longevity. So you look at the 1 year survival. Your 1 year survival must exceed minimum of 90% for you to have a program, which should be one of the important messages from this podcast. That, there is organ donation can affect so many people that if somebody dies, you should really think of donating organs. Technology is there. I think the problem is that most people are just unwilling or don't seem to be concerned about donation until it hits them. And that's the only time they think about it. But if you are to do good, you want to do good, there's something that a person after dying can affect life of at least 10 people.
What makes this organ donation one of the most powerful act of humanity? Or is there any patient story that actually deeply moved you? That
we've been helping government hospitals to start doing liver transplantation or kidney transplantation, because only then there's going to be a change. Because if you donate and you think that something like this, nobody would bother about you, then you would not feel like doing a reciprocal act.
So can you just walk us through that, whole set of journey from, identifying a donor and the patient walking home after the procedure?
And in liver transplantation, 1 year is a landmark time, because if you have survived 1 year, chances are that your liver will be with you for the rest of your life. So that's why the 1 year thing is.
Hello and welcome to Bluedot Podcast. This is Dr. Mohammed Afzal, your host. And this space we are going to explore people, ideas and innovation shaping modern medicine. Today we are going to discuss about a topic which truly saves lives, yet remains surrounded by fear, misinformation and hesitation. Organ donation and organ transplant. Every day, across the globe, there are thousands of patients who are waiting to get a life-saving organ. At the same time, we are losing a number of potential donors because of myth, less information surrounding this transplant program, and also delayed decision making. To help us understand this better, today we have with us one of the most respected face in this transplant program in the region, Dr. Subhash Gupta.
Thank you very much for having me here to talk about transplantation.
Dr. Subhash Gupta is a pioneer of living donor liver transplantation in India and chairman of the Max Center of Liver and Biliary Sciences. Dr. Gupta, welcome to our podcast, and it's a real privilege to have you.
Thank you very much, and it's obviously a topic on which I speak a lot. And there's been a tremendous growth in transplantation because the technology has become simpler, the costs have come down, and the results are amazing. And truly, I think transplantation is a gift of life. And therefore, I think programs like this, where awareness is generated, myths are busted, is very important. And thank you for having me here for this program.
I can't agree more on that, doctors. So, doctor, let's start with your career journey. You have played a historic role in the liver transplantation program in India. So, can you briefly walk us through that journey that you had from, let's say, from your training to becoming the pioneer in this transplantation?
That's a very important question, in the sense that it was almost a journey of discovery. So in 80s, when I was a medical student in All India Institute, and nobody actually ever thought that transplantation would reach such heights in this country.
Yes, that's right.
And mainly it was thought to be very high technology, a lot of care, aseptic procedures, and it required a cooperation between multiple specialists. And we felt that, a lot of people felt that it was not possible. But there were a few sort of fanatics in the country. And one of them, I must say, was my mentor, Professor Nandi, who actually worked in Cambridge with Dr. Stazel's colleague, Dr. Sir Roy Khan. These are two pioneers really in the world on liver transplantation. And they actually created the generation of transplants all over the world.
Oh,
And
okay.
Dr. Nandi was very keen, but unfortunately, he actually got everything got together in the sense the legislation and the stage for doing it. But transplant even then did not happen from him. But he sent us to me to England for training. And at the same time, what happened was that there was a growth in East on living-related transplantation, which was when they spent a lot of time in Korea and Japan and was able to bring that technology to our country.
Okay, that's a long, long journey, if you ask me. So, doctor, so when you started this that long back, how different is this transplant program from that times when you started to where it is now?
I'll tell you a very interesting story. In those days, every transplant would create a flutter. And actually, the hospital owners would be more scared. And it was regarded as a high-risk activity. So everyone was on the standby because obviously there's a donor, there's a recipient, and something goes wrong. And then there's a lot of media and press. So it was really very difficult times in those days. Process was not smooth, understanding was limited, and all the focus was on the surgeon because it was realized that it was the surgeon who was creating the damage. And in those days, it was damage. Yes, it wasn't success at that time. So there was a lot of challenges we had to face. But now, of course, it's routine. People don't even think about it. They come, get operated, and are home in 2 weeks' time. So the whole process changed. And it happened mainly because all around, whenever there is a transplant program in a hospital, there's improvement in every department. Say it's radiology, say it's anesthesia, it's critical care, intensive care, infection control, laboratories. Well, everything has to be precise, otherwise things can really go haywire.
That's right. I cannot again agree more to that, doctor. Let's see how can we understand this transplant program as such. Many of our listeners may not be medically trained as well. So for those people, how will you explain this transplant program as such, other than just the surgical part of it, how it is a total program?
I think this is a very relevant question you raised because in the past what it was the success of the transplant. So you did once transplant successfully, it made news. But that is not the case really. That is not what we are looking for. We are looking for a program where people who have early stage organ failure, whether it's liver failure or kidney failure, they're managed as long as possible on medical treatment or conservative treatment. For example, if it's liver failure, they can be supported by albumin therapy or by lifestyle changes or losing weight or stopping alcohol, taking antibiotics. So this part is equally important because if you transplant too early, then what will happen is that you'll have an enormous burden.
Yes.
And second, many people who can actually go on living perfectly well without transplantation will undergo a transplant unnecessarily.
Yes, that's
so it's
right.
important for groups, hepatologists, for surgeons, for nutritionists, all to work together.
So it's a multidisciplinary
absolutely,
approach, not just one
absolutely,
surgeon.
absolutely.
Yes.
So that's where the program means that there's a activity which links many professionals, including the patient and the family, because the family is the main caregiver in our part of the world. And they must be trained into looking after these patients. You don't want to transplant them early because, in the end, not all transplants are successful. So you don't want to shorten their life. You want to extend their natural life as much as possible.
I understand. So this program also consists of like a multidisciplinary team and also like organ retrieval, post-transplant care, everything
Absolutely.
included.
Medication and follow-up, and otherwise, it'll be a failure. So the focus is not on the surgery anymore, but it's on the longevity. So you look at the 1 year survival. Your 1 year survival must exceed minimum of 90% for you to have a program.
Okay, so what I can understand is it's a huge program that, as a transplant, as such, not just the surgery. But again, speaking of that, how do you think, doctor, how critical it is to develop such a well-structured transplant program, especially in places like, our part of the world where there is a lot of disease burden in case of liver, kidney?
This has been a challenge in the past. and it continues to be a challenge now.
Yes, of course.
And the reason for that is when people are well and you have identified that they've got advanced liver disease and they feel well, they do not want to have a transplant. They think I'm completely okay.
That's right.
They would want to have a transplant when they're very unwell. In the end, it is an operation. And if you do an operation when you're very unwell, the results will go down. So it's really what we've done, and the hepatology community has done really well in creating mathematical models. You're looking at the values, you can actually predict that in the next 3 months, the chances of this person dying are very high. So we would suggest a transplant only when the MEL score, which we use mortality from end-stage liver disease, that's what MEL score means, exceeds 25, the score exceeds 25, which means that the risk of dying in the next 3 months is over 25%.
Oh, okay. Yeah, so when we talk about this transplant program, we cannot proceed further without talking about organ donation as such. So like I was just giving just a glimpse of it in my introduction, this huge demand or the gap between that demand and the reception of organs, it's so huge nowadays worldwide. How exactly do you think that gap, or let's say that gap is so huge, we all know. What do you think that gap actually clinically means to the patients?
Yeah, I think there's a gap and there's a lot of interesting work has been done. One of the biggest advances in last 5-10 years has been machine perfusion, which means that if the organ is of poor quality, you put them on a machine, assess the viability so that it's actually producing bile, it's reducing lactate, and these organs can then be successfully transplanted. You don't throw away these organs. The second development that has happened is donation after cardiac death. That means you have had most deaths nowadays, as you know, happen in hospitals. They no longer happens at home. Oh, you slept in the night and didn't wake up in the morning. So that doesn't happen. Yes. It's all in the hospital. So even if the family is keen to donate after death, and which should be one of the important messages from this podcast, that there is organ donation can affect so many people that if somebody dies, you should really think of donating organs. Technology is there, so if the hospital and the next of kin are keen about donation, then so obviously you cannot touch them after cardiac arrest, but after 5 minutes, 10 minutes, they can be put on regional perfusion, which is ECMO is amazing in that, and then you can make the organs viable, and then you can go ahead with transplantation. So that's another one. And the third area where a lot of research has happened and is likely to revolutionize transplantation is xenotransplantation. Unfortunately, we have not done as much research in India as the Chinese have done. They've actually put pigs' kidneys and hearts. Livers, they're far away for many reasons. And many of these are knockout pigs in which the genes have been removed so that the pig proteins are not made and genes are inserted so the human proteins are made. So I think we're going to see a lot of interesting things in the future on xenotransplantation. So these are things that, but as of now, I think the problem is that most people are just unwilling or don't seem to be concerned about donation until it hits them. That's the only time they think about it. But if you are to do good, you want to do good, there's something that a person after dying can affect life of at least 10 people from various organs.
That's understood, doctor. So, in your opinion, what makes this organ donation one of the most powerful act of humanity, or is there any patient story that actually deeply moved you in that case?
I think only yesterday we had a young man, he's an engineer, and he was traveling on the road. As you know, in our country, it's horrible. Road traffic accidents are I think if we just controlled our road traffic, it's the biggest cause of death in young people in India.
Yes, that's right.
And that's really sad. And there's a 32-year-old engineer, and he met with the accident. Brain was completely damaged. Was on ventilator life support. But the father, who was an aged father, and I could see the remorse, the sadness in his eyes. But he was so keen that in spite of this being a medical legal case and so many hurdles, he stood by and ensured that donation happened. And we were able to use the liver and heart of this man. I think the motive in him was that he just wanted to see part of his son's body or part of his son continue to live in this world. And that was, I think, amazing story.
That's deeply touching, Doctor. And thanks for sharing that with us and the audience. Um, okay, organ donation, that's a very discussed topic. But again, as we all know, there are a lot of myths and misconceptions surrounding
Absolutely,
this.
absolutely.
So, these myths or this misinformation that prevents a lot of families from consenting to organ donation. There is no doubt about it. It can be like, body disfigurement, organ trafficking, a lot of that myths and bust. What do you think is the most common that you encounter in your career?
I think one of the, I feel that unfortunately, most of transplant activity in our country is in private hospitals. And in the end, private hospitals to survive, they need funds, they need money. So the people perceive, and so you have a real funny situation. In the public hospitals, people want to donate, but transplant activity is not happening there.
Yes.
But you have private hospitals where the rich people. This is I'm talking mainly in the Indian context. I'm sure it does not apply in the rest of the world. But so you have a situation where transplant concentrated in private hospital seems like a rich person's activity. So the great majority of people who get treated in public hospital just don't feel motivated to donate. So I think that must change. And we've been in that, we understood this problem a long time ago. So we've been helping government hospitals to start doing liver transplantation or kidney transplantation. Because only then there's going to be a change. Because if you donate and you think that something like this, nobody would bother about you, then you would not feel like doing a reciprocal act. So in the West, UK and Europe, where I worked many years, there's a national health scheme. So seeing that you do something, then maybe when you are in need for something somebody else will do for you. That feeling has to come. Till that time, I don't think organ donation will happen as much as it should, at least in the Indian situation.
I can understand that scenario very well, Doctor. But again, speaking of that, there is a huge, I cannot say myth, but lack of awareness regarding brain death as such. We know that it's so crucial to have that awareness as well in the society. So how crucial is this information or awareness about brain death in population for an organ donation perspective?
So it's a very important question again, because if you look at a brain dead person, he looks calm, he's well perfused, his blood flow is there. You can see the heartbeat monitor showing, good heart rate, good blood pressure, urine is coming, and the blood gases are good, and the doctors are saying this person dead.
Yes, it's very common in ICUs where I worked also. We had very tough time explaining.
So, it just does not, people will not understand that this is, but I think here, a bonding between the nurses, the doctors, and explaining to them that, the brain is the most important part of the body. And if that is gone, there's no trigger to ventilation. So it's like if you take somebody's heart out, or as we've done experiments in lab, heart beats on its autonomic rhythm. It has its job is to contract. It doesn't need the brain for it to contract. So you keep giving it oxygen, it'll keep contracting. So that's what that person is. His head has been severed from the body. It's only the ventilator is giving the oxygen, therefore the heart is beating.
Yes.
So this concept has to be explained to them. Images of the brain should be shown, that there's no image, there's only blood there. And brain, as you know, is a tight box surrounded by skull, and therefore even a small amount of bleed there will cause complete brain damage, and this person cannot recover.
That's really understood, Doctor. That awareness has to be gone into the society to keep this program actually running. That's what I understood. Okay, now we'll shift our focus from the donation part, organ donation part, to the transplant process itself, the transplant journey from the donor to the recipient. So can you just walk us through that, whole set of journey from, identifying a donor and the patient walking home after the procedure?
So I think if you're unfortunate to have organ failure, then of course the two ways of going about it. One is cadaveric donation. The other is, which is far more common in our country, which is living related. And for most organs now, for liver and kidney particularly, and even for small bowel and to some extent pancreas, this is possible from a living related person. The legal issues are such that only a family member can give. Unrelated donation, a good Samaritan donor, or altruistic donation is not possible in our country because of and that's rightly so.
Yes,
it prevents
That's the situation.
the exploitation. So once you've identified that you're in organ failure, you've taken multiple opinions from every doctor, you satisfied yourself that you're suffering from NC. Do not go to a stage where you are, say, for example, on unconscious ventilator. So the family has to make that decision whether they should proceed with the transplantation or not.
Yes, that's
so once, as an individual, as a patient, you should realize your disease and tell your family that if it is possible, you would like to go through the transplant process. At this stage, you can decide whether you want to have a living related or you want to have a cadaveric donation, transplant. Okay. Now, the problem with cadaveric is that the supply and demand business is actually...
Yes, to identify it at the exact time and getting the patient.
And to have the person who's fit
for that candidate, for that patient.
And that
a lot of things has to be on
match.
the same match.
All the stars have to align.
Yes, that's the exact way to put it. Yes.
Yeah. But the big advantage with living related, though it does put a healthy person's to some amount of risk, no matter however refined the surgical process, however experience is there. In the end, for the donor, it is a major operation.
That's right.
And can never be done, as I keep telling all my donors. But it's interesting thing. They'll say that, even if there's a little bit of risk, I want to do this because for me, life is useless if my near and dear one is not with me. Yes. So, but that all has to be explained clearly. Mm-hmm. And therefore, so once that part is over, and actually, interestingly, many recipients refuse, they don't want to trouble their donors at all. They say, they say, no, I will not take from my son or daughter. And then the son and daughter will come up to me and say, you do the operation, but don't tell him where the liver has come from. And we've done that on a few occasions, It's very interesting. Legally, you can do it. There's no need. If there's an adult, he doesn't require his parents or consent for donation.
That's a good thing, actually. So this difference between this living donor and the deceased donor. So how do you decide which path is best for this patient considering the situation?
As a blanket statement, cadaver donation is best for everyone.
Okay.
If
available.
But unfortunately, it's not. And sometimes I find that people are just waiting for that organ, for that, dream that an organ will come through. Yes. And that doesn't happen. They end up dying. We end up doing their operation when they are in extremely poor health, which means that they will not survive the operation. For any operation you do on anyone, for a couple of days or 3-4 days, you actually if you started from zero, you'll go to negative.
Yes, that's right. Yes.
So that's the problem we face. So when you're extremely sick, please don't allow yourself to become so sick that the operation itself becomes too risky.
Okay. And regarding this transplant as such, there are a lot of ethical and safety concerns. So, especially in living donor transplant. So, there will be, a lot of such concerns raised. How do you ensure that, this donor safety and ethical concerns in a transplant program?
Yeah, I think ethical issues are very important because sometimes what happens is that people in India, they find it very difficult to say no to their family members.
Yes, that's right. It's a custom.
They mean no, but they say yes.
Yes.
So it's very important for the transplant team. It doesn't have to be, it can be anywhere, to meet these donors separately away from their family members and ask them. And at this stage, what we've done, though you can question whether what we do is right or wrong, if we fear or suspect that there is some disagreement or some unwillingness, then we actually will make them medically unfit. We'll tell them that, this person is not suitable for donation, rather than create, problems in the family. And we've had many such occasions where quietly we've just said that so strangely, somebody else then comes forward. So donor coercion must be protected. They should never be, they should have a cooling off period so that they're not doing it in the heat of the moment. Go back, think about it, talk to other people and come back. Because in the end, we cannot ever guarantee 100% safety for a major operation like this. Yes. So that's something. And then, of course, once this part is done, rest is easy. Then, of course, they go through all the psychologists and see, they always say it's okay. Then if there's a brother going to brother, brother. Or we only do near relatives.
Yes.
So the government committees will clear that case very quickly.
Okay, doctor. So, and one thing about this quality and safety standard, what benchmarks define this a good quality transplant center if a normal person has to, go choose between centers?
So a good center should have, I would not say 100%, but should have near 100% donor safety.
Okay.
They should not. They should recover quickly.
The donor.
The donor. They should get back to work quickly. They should begin their normal life as quickly as possible.
Okay.
So although it can never be 100%, but near 100% as far as donor safety is concerned. As far as the recipient is concerned, we look at 90% 1 year survival at the minimum. And in liver transplantation, 1 year is a landmark time, because if we have survived 1 year, chances are that your liver will be with you for the rest of your life. So that's why the 1 year thing is. So it's unlike kidney transplantation, where, in kidney transplantation, initial part is because you can get up to 100% result in the initial part. But in the long term, there's some chronic rejection process happens in kidneys. So you lose 5% of the kidneys every year. But in liver, if you survive the first year, this organ is going to stay with you forever. And unless you, of course, start doing naughty things like drinking or, sedentary lifestyle, and you allow yourself to, then of course, this organ is going to go waste.
Okay, and just coming back again to the role of public awareness, because we cannot stop talking about that, because that's the most important part here. So if at all the public awareness is being increased to, let's say, 10%, 20%, how big an impact that can make in the whole transplant program?
I think if even 10% awareness, or I would not say awareness, I think is probably there, or 10% motivation.
Motivation, yes.
Even if the 10% of the people who died in the hospital, they were motivated to donate, I think it'll make a huge impact. I think we've estimated that 1 lakh people die from liver disease every year. And all of them could be, saved. And why not? Why should we not all have a longer life? I mean, it's stupid to say that we should only live as much as God has given us life. But, if the technology is there, medicine there, and you should,
why not
live as much as possible? So I think, and particularly there are many conditions which, no fault of your genetic conditions, and, where your life is cut short. And so transplantation has a big role. So I think even if there were 10% motivation from the public, it'll, as far as livers, there's 1 lakh people. And for kidneys, I think the estimate is about 4 lakh people die from renal failure every year.
Still a huge
so there's a huge impact on families. Sometimes these are the only breadwinners in the family. So I've seen families completely devastated and destroyed by one person suffering from organ failure.
Okay, that's a huge lot of information and awareness that you gave today, right now. But again, Dr. Gupta, if there is, one message, one key message that you want every listener to take today from this topic regarding organ donation and the transplant program, what would that be?
I think in the end, I must say, which we just talked about, that if you die, your body is going to be either cremated or buried. But please, your body is of much greater use. God created a system where, your organs can be used to benefit. One person can actually alter or change the life of 10 other people. So the heart, 2 lungs, liver can be split into 2. So these are things that, could be of enormous benefit. And nowadays, the technology is there that even after heart stops beating, you can still be done. So think about organ donation. Someone close to you in a hospital has died.
That's right. Thank you, Dr. Gupta, for such powerful insights and sharing that deep knowledge and experience with all our audiences. Thank you.
Pleasure to be hosted by. Thank you, Dr. Afzal.
Organ donation is not just a medical act. It's a gift of life, hope, and humanity. For all those people listening to me today, start your conversation today at home, at your society. Your action today can save multiple lives tomorrow. This is your host, Dr. Mohammed Afzal, signing off from Bluedot Podcast. Until we meet next time, stay hopeful, stay healthy, and stay informed. Thank you.